Hey guys, and welcome to Rnscrub. Today we'll be going over patient placement in bed. Now be truthful, how many of you pull your patients up in bed all the time like this? How long and how often have you guys been shown how to pull patients up in bed? And you keep thinking that they're sliding down in bed, so you keep pulling them up this way. Did you know that there's an arrow right there that tells you and guides you where to place the patient in bed? Now, this patient, myself, is way too high in bed. This puts a lot of strain on the hip area and also the sacrum. And if you see here, even if it's at 30 degrees, it's really too high. This can be detrimental in neuro patients. You need to know to properly place the patient. This is the improper patient placement. Too high. You don't want them too low either. And this really was uncomfortable laying down in bed. So now that you know that there's an arrow right there that shows you exactly where to place the patient's hip or iliac crest, let's show you how to do the proper placement. Scooting down a little bit, and then look to see that the pillow is placed right underneath the head and slightly behind the shoulders. Then you align the arrow with the iliac crest or your hip bone, or the patient's hip bone. You don't notice it really when you're laying down, but then suddenly when you put the patient up 30 degrees like we did the last time, there's a big difference in the comfort level and the strain or lack thereof. And it's perfect. This right here, this arrow, points to where it should be. The iliac crest should line up to that arrow. And this is it. Perfect placement, comfortable patient. You don't have to continually go back in the room and pull the patient up. Don't hurt yourself, don't overexert yourself either. Comment, subscribe down below. Thanks so much for watching.